Can you think of any examples where there's a drug shortage we came up with on that plan, this is the substitute, or this is how we're going to handle it, that just didn't work really well? Do you then go to plan C, plan D? Is it a flexible sort of a scenario? I mean, is it kind of a real-time, agile circumstance? Because plan B, there's a reason it's plan B, right? And not plan A.
Well, what happens, and I'm trying to think of a specific example, it's squeeze the balloon. Over here we go short.
Puts pressure on the whole
So the
system.
whole other related drug category, drugs within that category start getting squeezed. So they might be a third or fourth tier selection for whatever you're using them for. Now they float up to number one, but nobody's making enough to backfill 1 and 2. So yeah, you're scrambling a lot on that. And that it happens a lot with antibiotics when things go short. And you try to backfill stuff, and then and I'll speak in my own opinion, sometimes pharmacists are hoarders, and they will go out and grab what they can, which doesn't help with shortages. And then when the shortage is relieved, you're stuck with inventory. It goes back to your comments on waste. What am I going to do with all this stuff now that drug A is back and is our first choice? So I think it's dependent on the situation, but it gets tricky.
Yeah, and I think, some of the decisions that we make are very often, it's plan, we can think of maybe 4 very good plans, but we choose the plan that's going to be the least amount of informatics work. I will tell you right now, at our system, we have not been able to go back to having our usual bicarb drips because we don't have the manpower to go back and redo all of those order templates and order sets to make those changes. It was actually a good thing because even though we felt confident about our sterile water and our sodium bicarb, in more recent days, we're short again on sodium bicarb. So it ended up being a good thing that we didn't have that informatics time to do that. But in so many cases, the amount of labor and the amount of informatics changes actually dictate the plan that you have to make.
And it makes you a little gun shy to make the change because, wait, I was just short for 6 weeks, and now you're telling me I'm back up to speed. Well, we're kind of back up to speed, so do I want to pull the trigger? Don't pull the trigger? And that's where it gets kind of tricky.
So it's budget season, and you're making the case for more people, resources, forecasting software, whatever it might be. What's your best pitch to get more resources to buffer the effects of drug shortages?
My pitch and thank God I don't have to do budgets anymore, but when I did, we did service line budgeting. So we knew how many cases we were expecting, and it was, okay, these drugs affect this service line. These drugs have been short. This is what our plan is for this. So labor's always the tricky part. We spend 80% of our spend is on drugs, 20% on labor, yet senior officials focus on labor first and drugs second. So making that connection between labor and drugs is the hard part.
Interesting. So Aaron, it's budget season. You need an extra FTE to perform for the health system and the patients. How are you making that case?
That's a tough one. That's a tough one because I lost an FTE last year.
Okay.
So, we do try to focus on the efforts that we've made. We try to highlight our prevention efforts. It is hard to talk about the work that we do that ends up being invisible. So trying to highlight that work, we had to change this many order sets. We had to pull this many people offline to make a clinical plan. Luckily, we do have support of our medical staff who hear from colleagues maybe at their other facilities where they don't have product and they know that we do, and they will ask me, how did that happen? And, I say, well, it's because you worked with us to restrict the use, and so that's why we still have some. Maybe that organization was unable to make a plan to restrict. It's a tough proposition, especially when you also have to spend additional money on drugs. You might have to buy a more expensive product. You might have to buy things off contract. You might have to buy imported product that's much more expensive. And so we highlight those costs as well. But overall, we show we haven't had to delay any surgeries. We haven't had to deny patients care.